Good morning. It is that time again for Functional Friday. I am Becky Schoenig, one of the co-owners of Symbol. Symbol is located in Kirkwood and in Chesterfield. We are a healthy lifestyle focused restaurant. Food as medicine is the reason that we have started doing these interviews. And what we do on Functional Fridays is I like to snag the experts in the St. Louis and surrounding areas to have conversations around how food plays a role in your health and in your functionality. So joining me today is Dr. Jason Wibbenmeyer. How are you?
Hello, I'm great.
Good. I know, did you have a snow day yesterday or did you actually work?
I came to the office. I trekked through the snow and I got to the office, and I don't
It
get
wasn't that
it
bad.
was not bad.
It was really was.
Our patient still came.
Yeah. Well, hey, I just wanted to bring everybody up to speed really quickly. If you did not see our live interview yesterday, we were invited into Venture Cafe last night. We spoke on food as medicine, and we streamed that live. So if you're watching this and you're interested in more about what we're doing and some of the topics that we're talking about, I'm going to encourage you to go back into our feed and watch that video because it explains a lot as well. But today we're going to be talking a little bit more about gut and brain health, how they relate to each other. We had posted an article earlier in the week about this, being more specific with children and anxiety, autism, all that. But Jason, tell us a little bit more about you, who you are, what you do, and why you do what it is that you do.
All right. So as you said, I'm Dr. Jason Wibbenmeyer, and I practice functional medicine. I am chiropractically trained, and I can get a little into kind of how I started practicing functional medicine later. And my practice is in Old Webster Groves here in St. Louis. I practice functional medicine because of my own battles with health in the past, and I like this topic because of that, with my own gut brain. And at the time I didn't really know that that's what it was, but now looking back at it, I was able to identify that is exactly what I was dealing with.
So can you explain what that was? Like, explain your story. Like,
Sure.
Let's just get into your story, because I think when we go into the personal stories, it's much easier for people to relate, and then I can ask more of the questions to get onto more of the professional side.
Yeah. So I went to chiropractic school, and as you probably have heard, chiropractic school it's tough. It's hard on the body, the mind, every system in the body. And I learned very quickly that as I was learning to be a healer, you have to take care of yourself, because that's exactly what happened. I was not taking care of myself. I found my health declining. I was getting GI issues that seemed out of nowhere. I started developing anxiety, and to the point of panic attacks. I don't know if you've ever had panic attacks, but they're not fun. And after my fourth one, I said, okay, there's something going on here. I got to figure out what this is. So, at the same time when I was in school, I have three sisters, and two of them were diagnosed with two different autoimmune diseases. Now, again, I was in chiropractic school, and I was learning a little bit more about autoimmunity and learning what I knew about it, and also knowing that the odds are in my favor that it's probably in my genetics that I could have an autoimmune disease within me. And I knew at that point I had to make a change. I had to change my lifestyle. I had to do something that was in my power and control to change my life, because I wanted to be the best healer for my patients moving forward. And one of the first things I did was I changed the way I ate. I definitely saw a decline in my diet and my nutrition. I was eating convenience foods. It was cheap. I was a college student, and I was eating Five Guys burgers and fries and Chipotle like every single day. It was crazy. And once I cleaned up my diet and I went through a detox program, I started seeing my anxiety really, fizzle away, essentially, and my panic attacks were gone.
So I'm gonna pause you for a moment, because I just want to make sure that everybody is clear. Just because you were going to chiropractic school was not educating you on functional medicine. Is that correct? I mean, you were going into some areas, but a chiropractor is not necessarily a functional medicine doctor. Can you tell us what the difference is, and then why you decided to go into onto the functional side?
The difference is chiropractic really focuses on the musculoskeletal body and the issues coming from a nervous system standpoint. So it's really big on taking away the irritation that could be hindering the nervous system from making the full body function optimally. So from a physical standpoint, that is, I would say it's a an element of functional medicine, because the physical
Right.
body and the structural body is definitely needed. And full health is needed for functional medicine, but it encompasses so many other things. And so at that time, I had to really figure out, what does it really take for the whole body to heal? And it goes beyond the chiropractic adjustment. And that's why I practice the way I do. I really look at my practice, I look at my patients from a physical standpoint, not necessarily just musculoskeletal, but nutrition. What are they eating? What are they putting in their body? And then also an emotional standpoint. I think the thing about functional medicine that really makes it powerful, that sometimes goes missed in other forms of medicine, is the emotions and the mood and mental outlook of our patients, and the power that has on getting them well.
Okay. I think the way that I like to explain it's no different than a medical doctor who's a general and general doing general practice, family practice. They're not specializing in any specific thing. They're referring you over to a specialist in those areas. So a chiropractor is not necessarily specializing until they take their education beyond.
Correct. I explain that the same way too. You can be a general practitioner and practice family medicine and not really be specific. You just kind of see everything. But functional medicine, and even within functional medicine, you can then specialize even deeper within functional medicine as well. And so I think it's a more of a specialization approach.
So we posted an article earlier in the week in regards to gut bacteria, and Dr. Matt Flory had then commented, the gut is your brain and brain health. And then you had brought this topic up to me today, and I'm going, okay, let's talk about, what do you mean exactly when we're saying gut brain health?
Yeah, gut brain health, it's essentially one. So embryologically, so as an embryo, the gut and the brain are at a cellular level the same. And then when we grow, they are separate entities, but have the same memory. And so in medical school, in chiropractic school, we learned that the gut is called the second brain. And because of that interconnectedness between the two, it's connected by the nervous system. And that is why you can have a patient come in that has gut issues, but also has brain issues, or vice versa. So when I have anyone that comes in the door that has anxiety or mood disorders or brain issues, concentration issues, I'm usually asking about gut health and what they're eating and what they're putting in their body, because it's going to be directly related. And a lot of times I get a little bit of like, why are you asking me about this? But then once we get the ball rolling, they understand, especially kids.
It is really interesting how, I have worked in this arena for so long, never correlated depression or anxiety to necessarily food. And then I started seeing a doctor, and going back through my history of being diagnosed with bipolar depression, all of these different things, it really came down to, I had an autoimmune issue, and gluten plays a huge impact and role, and I've got a gut infection. So it is, I think we're just starting to tap into this, but what can you explain, like what you start doing with somebody? What are some of the protocols, some of the tests that you might be doing, and some of the results that somebody can start having, and how quickly?
Sure. So as I said before, when I have someone comes in, I always do a full assessment to check out the full body, but then obviously you're going to focus on what they're coming in for. So if I have someone coming in with obvious brain issues, I'm asking for past, brain trauma. family history of any mental diseases or disorders, as well as the gut. You know, do you have autoimmune disease in the family? Do you have IBS? Or have you been diagnosed with something in the GI? And really, when it comes down to it, you're looking for levels of inflammation, because that's what it comes down to, is the inflammation in the gut or is it in the brain? Because depending on where you find it, that's how you begin treatment. Sometimes we think it's in the gut, but we actually need to treat the level of the brain in order for the GI to get better. And so there's lots of different testing out there. There's different autoimmune panels we might run. You know, we at my practice, we run so many lab tests, but it's really to be specific on what you're looking for. We run plenty of stool tests on patients. You know, there's some newer advancements in GI testing to really determine, especially with gluten, at what level is gluten causing inflammation and where. You know, I think gluten, with it being a big buzzword now, kind of a dietary fad for some people.
Right.
I think that we are way past the point of thinking that you only have to have celiac disease in order to be gluten intolerant. There are so many other ways to have a sensitivity or an intolerance to gluten without being diagnosed with celiac. So there's lots of really cool tests out there that we can send out to determine what level, as well as then what to do about it, and then, you know, how to heal.
So when you send out these tests, does it say, can you eat pizza, or how many days a week can you eat pizza? Because that's really all I care about.
Exactly. I know, you know, the gluten-free crust pizza, you know, there's lots of different great places around town to support those vices that we have. You know, it's funny because we have patients, you know, and we struggle with it too as practitioners. You know, we find out we have something going on and we're like, well, can I get away with a little bit? It's like, you know, you're either pregnant or you're not. You're not a little bit of, you know?
I like that.
You know, so if you are intolerant to gluten, you need to stay away from gluten because it can just wreak havoc throughout the body. So,
right. I also like to say that it comes down to a choice in each individual person's reactions to it. And sometimes you just say, yes, I'm willing to have whatever the consequences are that next day or that in 2 days. But I for myself, I noticed that the more I stay away from it, and then when I go to do it, my symptoms are almost worse every single time. So I'm not quite, although then I'm like going, oh, I messed up today, I may as well mess up the rest of the weekend and then get clean again.
Right. Like a downward spiral.
So when a baby is born, because this is kind of coming to me, when a baby is born, I would assume if they're born completely healthy, their gut is healthy. So when does it start changing? When are we starting to get affected? And how as a parent can we get on track and start working with our kids sooner on this?
That's a great question. So one of the first things I ask my pediatric patients is, when mom and dad are in the room, is, you know, how were they born? Was it you know, through C-section? Was it vaginally? Were there any drugs involved? Because, you know, if you are born for the most part healthy, you're on the right start for building that immune tolerance. But how you are born determines a lot about how the microbiome or the bugs that are throughout our body and our gut. So for the most part, the main things that affect those bugs in our gut are going to be medications, specifically antibiotics. There's so many antibiotics being prescribed to children and babies for ear infections and lots of different other health issues that even, you know, may not even require antibiotics. And our immune systems and our guts are still developing for a couple of years after being born. And so that can really take a hit with the medications. Also to consider is, what are you feeding baby and your children? I think getting a head start on understanding and educating your kids on what are healthy foods and what makes you nice and strong and powerful and what makes your brain work. You know, I joke and I say, you know, kids eat beige. You know, if you ask what they eat, it's sugar, wheat, and dairy. There's no color to it unless there's food dye in there, you know? And so those processed foods and those inflammatory foods that they're eating can really decrease the effectiveness and also the amount of the bugs and the bacteria that are found in the gut.
We get a lot of the parents that come in asking us at the restaurant, how can I get my kids to eat healthier? I think the answer always is, number one, your kids are going to eat what you're eating. Your kids are going to eat what you have in your home and what you buy. And three, I like to, when they're in the restaurant, I don't like to push kids into eating something that they don't feel comfortable with or that they're not wanting. I tell the parents all the time, when your kid is in here, they're getting 100% whole food. It doesn't really matter. I don't care whether they choose one vegetable or all of the vegetables, but we want them to feel safe, and we want to feel like they're being heard and that they are in control of the food that it is that they're choosing and wanting. I find that to be way more successful. And when the kids start experiencing that in a restaurant like ours, it becomes one of their more favorite places to go, because they're in control, and we can gradually start getting them into eating other colors, other flavors, other things that they may not have otherwise.
Oh, you're right. I think that you hit on something. There's this quest for parents, and they get frustrated, because they're wanting their kids to eat well and eat healthy, but they're pushed up against the wall. And you're right in saying that give the kids choices, and I don't mean by, hey, you can have a carrot or a cupcake. Give them choices of, hey, you can dip either a carrot or a piece of celery in the hummus, and give them the choice, because I think human nature, we like to have that, a little bit of that control. I think that's a big part of it. And you also hit the nail on the head when you said, if it's in the house, who's buying it? And so a lot of times when you're working with children, you have to ask the parents, well, what's being brought in the house? And it's usually as a family unit needing to be a little bit more of a healing process as well.
So a question going back to that newborn baby is, if a mom is breastfeeding, is what the mom ingests 100% affecting that child?
I don't know if I would say 100%, but a big chunk of it, yes. Definitely what mom eats, baby is going to get. That's why you have to be worried about any kind of, as a breastfeeding mom, you have to be concerned about what you're eating, medications you're taking, things that you're just, your environment, because what you're exposed to, that, baby is going to get, and that can impact the baby's immune system and GI, because it has to be processed. I will often see, if I have a baby in the office and they have colic or projectile vomiting or stomach upset, I'm usually asking, mom, what is she eating? And I might have to pull away and eliminate certain foods that mom might be eating and do some healing with the baby. And usually when you do the combination of the two, you'll see that those GI upsets will go down.
And am I correct in, because I know a lot of people seek out functional medicine or go down this route when they're having gut issues, but am I correct when we're talking about gut-brain health, that even if you're having just the depression, the anxiety, all of that kind of a response in yourself, that also is oftentimes correlated to the gut, and that's where a functional medicine doctor can help?
Yeah, it can be. So I can't say that every case of depression and anxiety is going to be directly related to the gut. There are other reasons why you might have those mental and mood disorders. But, a lot of times if I have a patient that has those, let's say depression and anxiety, if they have it long-term, you will typically start finding GI issues happen down the line. And so that's that direct correlation, that if it's not being taken care of, if, let's say they're on an SSRI or a medication for depression, but they're not cleaning up their diet, and they're not changing what's causing the depression or anxiety. If it's something that can be changed, then it can go downstream into the gut. It's so funny, because when I was in my 20s and was diagnosed with the depression and the bipolar, and they were putting me on the medications, and the medications were not working, and they were wanting to put me back onto another medication that had worked, but it had made me gain a tremendous amount of weight, never made me really feel that great.
that was when I said, I don't want to go back on that, and started seeking out more advice and started doing research, not knowing anything about all of this. And that was when I found the natural side, food, herbs, all of that. And unfortunately, when I had asked my psychiatrist back then, this is the route I wanted to take, I was fired from her. She said, I received a letter in the mail. So it can be challenging. And that's where I don't want to confuse people and say, hey, when you're diagnosed with this and you're on a medication, don't go off your medication and then go this. It really is a stepping stone of figuring out what works for you.
It is. And as a consumer and as a patient, we can get really confused as to what route and how to approach this. And so I have so many patients that have anxiety and depression and other mood disorders that, we slowly start working on both affecting the brain inflammation and what might be affecting that, as well as the gut. And throughout time, I can't tell you how many times we've seen patients just say, you know what, I think I'm ready to talk to my doctor about weaning myself off of this medication because I feel like I'm able to support that. And then if they go through the process, being monitored by their prescribing physician. But you also mentioned at the point, not all doctors are open to that way of thinking.
Right.
I think it's for some doctors, it's out of their element. It's not something they're taught. It's not something that's within their scope of practice either. And they're more comfortable with saying, no, you need to take this medication and just monitor them on that. Rather than figuring out why. That's what functional medicine is really good at, is figuring out the why and getting to the core essence of why you need to be on a medication or why you have these health issues, instead of just doing a medicinal matchmaking game.
I will also say that it is important as a patient, if you're watching this, that you are the advocate for your own health, that nobody knows your body and knows you better than you do. So when you're seeking out answers, asking questions, even though you may have a professional that is giving you responses, you've got to hone in your gut instinct. That intuition is going to guide you. And if something doesn't sound right, ask more questions, go talk to somebody else, and keep seeking out the answers, because you're actually more on point oftentimes. That doctor doesn't know. They're only taking in the information that you're giving them. Yeah. I mean, am I correct? Or am I?
No, it's funny. I get the patients that come to me and say, I don't want to be on this medication, and I know I'll feel better off it, but they won't go to their doctor. I'm like, I can't, my hands are tied. I can't tell you to do anything about that. But I think there's this fear of what their doctor's going to think, and but there's also there's this sense of unknown. And I think with patients trying to get that, be an advocate and gain that control, there's a sense of power that comes with it, but there's this fear of, well, am I going to lose, my doctor along the way because I've been with them for so long?
Right. Yeah. I had a woman that came in, she's going through cancer treatment, and she's going a natural route. She has to come from Kansas City to St. Louis to see this specific doctor. And they have her on 100% plant-based diet. She's lost a tremendous amount of weight. Wow. She was a triathlete years ago. And she said to me, she goes, I know he's got me on this plant-based diet, but she goes, I keep feeling like I need bone broth. She's like, I just feel like I need bone broth. And I looked at her and I said, I am not here to prescribe or diagnose anything, but I said, I think you need to trust what your gut is telling you your body needs. Yeah. And she's added that one component into her diet and just doing the vegetables in addition to it. And she now has a little bit more energy and clarity. So again, it is interesting having these conversations.
Well, and you're right. Like, I think we need to trust our intuition a little bit more. We are our best doctors, ourselves. And the actual doctors are the facilitators of allowing your body to do what it's supposed to do. So I love what you said about just trusting your gut intuition.
Yeah. Gut, intuition, gut, brain, It all seems to be the same.
Exactly.
Jason, tell us a little bit more about what you've got coming up in this next year, because I know you've got some workshops and some classes where people can kind of tap in and get some more help also.
Yes, we just launched some exciting stuff here at the office. We've created different access points for patients to work with us beyond just one-on-one care. So we have these classes coming up. It's called the Wellness Academy, and we have right now 4 topics that tend to be the most commonly discussed topics. So we have restore your gut, restore your brain, restore your hormones, and restore your immune system. And the one that's going to be launched in January is going to be the gut. So it's perfect timing because it's coming up soon. You can register on our website, and I'll add that below.
Perfect.
Yeah, but these classes are going to be taught by us at Innovative Health Partners, and it's just a great way to, as a patient and as a consumer, to get more information to work with, because again, there's a lot of great information out there, but hopefully this will kind of pull it together and help you with that next step.
Perfect.
Yeah.
Perfect. And I hope that Symbol can play a role, or you invite me in to speak or talk to your community here at some point. Tell us why doctors love Symbol. Tell us why Symbol needs to be a part of a family in their healing.
Yes, doctors, and I love Symbol because, as you mentioned earlier, it's great, healthy food. Food is medicine. And so when we have patients that either need a specific way of eating or a specific diet, or they are or eliminating certain foods, you can guarantee that when you go to Symbol, you're going to have those options. The work is done for you. You do it for the patients, and it's super good and flavorful and healthy. And I think that's honestly, I mean, that's the bread and butter. That's why people love it.
And we have fun while we're doing it,
and
too.
We have fun. It's a fun place. It's colorful. It's fun. It's great energy. I love it.
Jason, I want to thank you for joining me today. I wanted to acknowledge Melissa Ann, and I believe somebody else commented, Karen commented earlier. We appreciate you tuning in. We appreciate you watching. Please share these videos with your friends, with your family, so that we can make sure that all of these resources are being shared out there. Jason, one last question for you.
Yes.
Well, what will you be eating for Thanksgiving?
Oh, that's a great question. My sister has celiac, and a lot of my family members are gluten-free. So my mom makes a fantastic gluten-free Thanksgiving. So I will be eating traditional turkey and pie, but it'll all be gluten-free and mostly dairy-free.
Lovely, lovely. So your entire family kind of relates to it, understands it. Yeah. I am gonna ask one more question, just because this came up, is how do you, if you have these dietary issues, how do you function going to a family who's not going to accommodate all of these needs?
Yes.
When you don't know 100% what's in anything, and you don't want to feel awkward and odd asking, hey, what's in this?
I'm past the point of feeling awkward. I will just, I will.
I know you are, but somebody has
my patients just to ask, So you either just have to have a plan going in and just either have to be comfortable asking questions, or you can offer to bring and provide food that that you can eat.
Yeah.
And I would say those are the 2 best options, so that you don't feel like you are feeling deprived or feeling like a loner on the side, not eating a certain way on Thanksgiving or during the holidays. Yeah,
exactly. And I think we still have some of our menu items up. So on Symbol, MySymbol, MySymbowl.com. I'm not even 100% sure, so don't quote me on it, but I think you can still place orders up until, I believe, Saturday for the gluten-free and vegan sides. If it's not up, just message me. I can probably get you added onto the list without any problem.
I will definitely share that on our Facebook page too.
Perfect. Perfect. Jason, thank you again for joining us this morning. Again, my name is Becky Schoenig. I'm one of the co-owners of Symbol. We're located in Kirkwood, on Geyer and Manchester, and down in the Chesterfield Valley area on Edison and Long. We are the restaurant that your doctors are eating at and that the doctors are sending their patients to. That actually is how I wound up tapping into this industry and into meeting many of you guys, is because your patients were coming in and we were going, who sent you here? And I'm being told all these doctors. So thank you, Jason, for the support.
Yes.
Yeah.
Yeah. Thank you. Easier.
Thank you. Thank you. All of us working together makes things a whole lot easier. Like our Facebook page, keep hitting those heart buttons and letting us know that you've watched this, and share these videos as well with your friends and your family. We will talk to you soon. Thank you.
All right. Thank you.